Hi there, everyone. Welcome to an evening with Rajvin and Waran. It's a lovely Saturday, I must say, and thank you so much for joining us here. Today, we will be having yet another guest, fantastic person, and she will be giving a talk on eyes, a specific subject, I must say, but tune in to learn more because it is going to be very informative. So let's get started, and can I call upon our lovely lady Rajvin Kaur Randawa to do the honor. Rajvin, hi there. How are you doing, Rajvin?
I'm fine, thank you, Warren. Thank you for uh, having this show with me every Saturday. I'm so honored. Uh, we've got in the past we have had a great time to many more with
Uh-huh.
our amazing guests. Today we're
Yeah,
gonna have fun. So, ladies
perfect.
and gentlemen, um, how are you guys doing? Hopefully, everyone is having a lovely Saturday. In Sat Sri Akal and welcome to Rajwin and Warren show. This week on a lovely Saturday, we have um, we we have with us Miss Casey Chu, an orthoptist by profession. She's a speaker. She's a lovely lady, and to know more about Squint and Lazy Eye, let's welcome Casey Chu.
Hi there. Hi, Casey.
Hi, hello. I'm sorry I have to rejoin because the line dropped. Hello.
Yeah, it's okay. It's okay. How are you doing?
I'm fine. Thank you. Hi, Rasrin. Hi, Warren. Hi. Hi. Good evening to everyone.
Good evening. Good evening.
Given.
Yeah, good evening.
Go ahead, Rajvin.
So Casey, you're a very lovely lady, charming. Uh, as far as I've known you, you're very lovely. So tell us more about yourself.
Sure. Thank you, Rasrin. She's always so gracious.
Yes, indeed.
It is indeed an honor to be here. Yes, it's indeed an honor to be here. And thank you to all who are listening in. I'm actually saying thank you, Rashwin. You're always looking happy and smiling all the time. I think that is your trademark. Be happy and smiling. It's something I think we have to learn to emulate. Okay? And I am actually um, an orthoptist you should be listening to today. Now, when I first started in Kuala Lumpur, I was working at the eye department at Hospital University Kebangsaan, Malaysia. For the last 30 years, I have been in my own private practice, and occasionally and wherever needed, I continue to help out in sharing orthoptic knowledge with hospital and at workshop. And today I'm actually very glad to be able to share a little bit about this allied health profession, which is actually quite alien to a lot of people. And thank you, Rasrin and Warren, for inviting me.
Um, I'm sure it might be challenging to uh, to be an orthoptist. Can you share a little bit what are your daily challenges you face as an orthoptist?
Okay. All right. Yes, it is challenging, and that's because mainly the orthoptists work with children, very young children, infants, and especially even including the very active and special child, and also all the way to the aged parent and the elderly. If you have children, you will understand, and especially they are all very active children. But however, um, the occasional apprehensive children, if you work on them, I'm sure as Warren will tell you because he's into all this training, eventually, actually, it's very rewarding to know that you are able to help them. And I have shown, I think, a slide here. Maybe we can show one of the slides on the picture, the first slide of the PowerPoint. Yeah, you see, I have shown you a picture here that see most of the children, most of our patients are actually children. Here on the occasion, we do have difficult children, and this is one of those rare photo I have that sometimes parent brings the children in just because they would not be able to comply with the tests. Okay, so but not that we do it to all our children. Okay, but most of them, I say, they with a little bit of coaxing, we are able to work with them quite well. So this is actually one of our challenge. But other than that, we are doing fine. Thank you.
One of the common eye problems, one of the many common eye problems among children is lazy eye and squint. So, can you tell us more about these two terms?
Sure, thank you, Rashid. That's a very good question. Actually, there's a lot of confusion. A lot of people think that lazy eye and squint are the same, but actually they're not the same. But they can, but a lazy eye can happen because of a squint as well. Now, basically, lazy eye is or term amblyopia. Actually, is related to the clarity of seeing. Where squint is also termed strabismus. It's just telling you that the eyes are not straight. In the very obvious, as you see in the photo, these are the common type you normally see. Then you can see very obvious misalignment of the eyes. Both in the eyes are not looking at the same direction. One is looking straight at you, one is looking somewhere else. If you look at the next slide, okay. Now, to better understand the term lazy eye, we need to first understand what is normal vision development. It is essential because amblyopia or lazy eye is to do with clarity of vision. Can I have the next slide? Slides, the next one. The next slide. Warren, can I have the next slide?
Yeah.
Warren, can I have the next slide?
Yes.
Sorry, can I have the next slide? Yeah. No, the one before, the one before, the one before. 3C. Yes. 3C. Okay. Um. Yeah. Yes. Correct. Now to understand, go back one slide. Warren, go back one slide.
Here you go. Okay.
Yes. That's right. Now, to understand the term lazy eye, we need to actually first understand about how normal vision is established in children. You see, as you look at the photo, in a newborn baby, the baby sees very little. Vision is actually very poor. And what happened is that, however, over the next few months when the baby is born, the vision rapidly improved. It starts to develop. But they require certain condition, which means you need to have clear visual input. That is very important. And vision will continue to develop all the way until the age of 7 to 8. Some will tell you that probably up to the age of 10 years old. The next slide. Warren, can I have the next one? Next slide. Next slide, Warren. Next one. Okay. Now, for normal healthy vision to establish, what you require, number one, is actually the eye must be healthy. There must have normal visual apparatus. The visual input must be sufficient and clear, and this is very important. And there must not be a presence of the squint. So if the eye must be aligned for normal vision to establish. Now, look at the picture. If you look at the photo, on the right side, you see a clear apple. We are giving you an image here, which is viewed as clearly by the right eye, captured clearly by the right eye. You have to go back to 3C. Yeah, correct, Warren, 3C. Now, the right-hand side receive a clear visual input. So this is submitted to the brain. It's actually the stimulus for your vision to form. The left arm receive a blurred vision. And this blurred input is now submit to the brain. So the brain actually does not receive enough sharp input for vision to form clearly. Slides. Next one, please, Warren. Next. Yeah. So here, the right vision will form normally. The left vision in the child during the period of from birth to the age of 7, once they do not receive enough visual input, the visual system is unable to process to the normal capacity. That is because the vision in that child is not fully formed for their age. They do not reach the actually visual potential. So this is termed lazy eye. In other words, the eye is apparently healthy, normal, there is nothing wrong, but due to the lack of sufficient visual input, the vision in that part of the brain, which is in this case for the left eye, do not develop to the full visual capacity. So this is called lazy eye. So in underdeveloped vision. Next slide, please. Now, a squint versus squint is different. The 3E, slide 3E, sorry, 3E. The slide before, okay. Now, to understand the squint, we have to know that squint is actually when people look at you, the eyes are not straight. Usually, you are able to see it if the squint is large enough. Okay. Now, here we have to again understand what is normal. Eyes are normal if there is no squint. So in this situation, in order for us to have normal binocular vision, what you require is actually the eye must be in the right position, the eye systems are normal, the visual inputs are actually received simultaneously. The important word is actually they must be received simultaneously, and the two eyes must be straight. So if they are straight, what happens is that normal visual binocular development occur. So the brain receives the two images at the same time, and these two images are then fused into one, and they eventually give rise to binocular vision and is appreciated as depth perception. So many people hear about 3D. That's how your three-dimension perception is actually formed. Now, this is important because it is this coordination that actually help you to maintain alignment for life. So this is one of the very important systems that maintain alignment and stop you having a squint. The next slides, please. Now, the other thing that keep your eye in alignment actually is the muscle. Here, this is the front aspect of the eye. Earlier, we talked about the binocular vision. That is actually at the higher center, which is at the brain level, at the visual cortex level. So it's very much like the software in your brain. Now, the hardware is the front part, which you can see the position of your eyeball. So your eyeball actually keep straight by muscle. So in human, there are 6 muscles. 2 that pulls your eye to the left and the right, 2 that pulls your eye up and down. So altogether, you have 2 top, 2 down, 2 left and right that give you 6. So they have to maintain alignment. And it's this alignment that is maintained that allows the child in the first 7 years of their life to establish the binocular vision or the 3D system, which is actually important to maintain alignment of the eyes. The next slide, please. Okay, the next slide, please. Now, however, when a squint occurs, what happens when a squint occurs? Now, when it occurs during childhood, then the system no longer can develop normally. Now, if you refer to the picture here, you will see that one of the eye is looking at an object that you presented, for example, the house, but the other eye here, the left eye, is looking somewhere else at some other target, which is a plant here. Now, if the eye receives both the image at the same time and is submitted to the brain the brain get confused, or they appreciate as double vision, two images. Now, in children, because they're very young, the brain readapt. So readaptation takes place. They learn to actually suppress one image. Essentially, the eye may be open, the two eyes are open, but only one image is processed. So the other one is actually shut down. So if you leave it like that and without an input in one eye in a young child, can eventually actually lead to lazy eye. Because of lack of input, the vision does not form. Okay, the next one, Warren. The next slide. Okay.
Um, that's a very good explanation, JC. So what is the difference between the what is then the difference between the both of them?
Okay, now, as we mentioned earlier, lazy eye is basically relating to poor vision. Vision that did not form or did not develop normally in a healthy eye in the first 7 to 8 years of life, due to basically a lack of visual input or lack of quality visual input. So there may be many reasons for that. Sometimes as a lack of understanding, the parent do not discover that the child needs to wear glasses and the visual input is very poor, and sometimes due to some obstacles. Sometimes children can be born with cataract as well, and of course, a large number of them can be due to screen. So in the presence of a screen, the brain only actually process one input. So the other one is shut down. They don't use as a pair. So as a result of lack of input in one eye, they can have a lazy eye. So that is what lazy is about. Whereas screen is different. As you see in the picture, on the slide here with the screen. Screen is something that to do with the eye alignment. The eyes are not aligned. You see, as you see in the picture here, one is looking straight and one is looking somewhere else. It could be looked to the left or towards the nose. And because of this, the brain is unable to coordinate the two images. Okay, so this is what is the difference between the two. Rajvin? Okay.
Yes, very well illustrated. Uh,
I hope that's
thank you for your
okay. Thank you.
explanation. So
Okay, the next here.
now we go to the assessment. Many people are asking,
Okay.
once my child has lazy eye, what are the assessments required for it?
Okay. I also have prepared some picture to show you. So if you can go back to the slides again, Warren. Can we go back to slide 5? We might be able to show the audience 5A. Can we show 5A? The slides, the PowerPoint. Slides number 10. Yes, that's right. Okay. Now, it's quite a complicated topic to discuss just on assessment, but I can quickly just mention that you need a lot of skill, trained skill, you need some equipment, and need a lot of knowledge to manage the child as well. First and foremost, I think the preliminary part is actually to make sure that the eye are healthy and normal. And therefore, the next part is to make sure that if they need glasses or spectacle, then it should be given to them. And of course, then to look at the cause, what have caused them to have the lazy eye. And then, of course, at the same time, you got to assess the screen. And if there's a screen, to assess the binocular dysfunction. Here, we have just some picture to show you. Perhaps someday we'll be able to show you on real life. If I could have the next slide, number 11. Here is a method of also the next slide, 5B. Lauren, can I have 5B? 5B? Yeah. So this one is also a method to show you how squint can be measured. So this is called a synoptophore. The left eye is the one that is straight, looking through at the target. See the right one, which I circle in yellow, it has deviated out. So essentially, the equipments can be moved so that you can place the two light. If you notice, there are two little light reflects on the cornea. Now, you have to place the little light reflect into the middle of the pupil. So that's one way of looking at it in an easy way. But of course, there are various ways of assessing them. Okay, so this is one way of measuring and assessing the child visual, the alignment of the child, the angle of defect. Can I have the next one? Now, a method to measure squint. Now, this is a video. I just want to show you a very simple method with using a prism bar to measure the angle of the squint. Do you think we can show? Yeah, thank you. So we assess. See, the eye actually move because it's trying to take up fixation or to try to look at the object you ask them to look at. Warren, can we play it again one more time? Can we play it one more time? Okay, you see, as you cover, the eye move up to look. And we put up a bar with the prism. It comes a point when the eye no longer moves. That is actually the angle of the squint. So this is a very common method of assessing the angle of the squint. Okay.
Okay. Many people would many parents would like to know. Okay. When they say my a child has a lazy eye, so a common question they can ask, how can we tell whether our child has lazy eye or not, and how long does it take to cure the lazy eye?
Okay. Yes, Rajvin, that is actually a very common question, and a lot of parents would like to know about that. Actually, to pick up the lazy eye, I think sometimes there may be signs. Sometimes you see signs. If you suspect that your child do not see well for their age, they go very near to TV, they hold something very close to their eyes, and if they are clumsy, they tend to fall, they knocks onto things, tends to like rub the eyes a lot, and you then may like to bring the child for a checkup. But you need to be able to assess actually the eyesight. Like we said earlier, a squint is actually to do with actually the eyesight. So you need to be able to tell how much your child see. So these are some of the probably sign parent should look out for. And treatment time, if you find out the problem early, and depending on the severity, the age factors, and compliance, usually they do very well. And in fact, most of the Asian in the city center, because of the program that are running in school and by the government, they do actually assessment on school children. So a lot of these things are picked up very early. And once they are picked up, all you need to do is quite simple. Sort out their cost factor as to why are they not receiving the input. Example, wearing the glasses. And for squint, normally you will be able to see. So with that, usually the prognosis of early discovery, children with squint and discover early, usually are very good. If you look at the next slide, now, so first thing is that if they require glasses, you should consider giving them the glasses, and then look at the needs to treat the squint itself. So the time duration for treating the squint can be anything from 6 months, and sometime after 6 months, you might require to actually do what is called a maintenance. Usually, if the lazy eye relapse, then you go back in to do some more treatment. So averaging, I think until the age of about 7, 8, you might need to monitor the child. Okay.
That's very good information. We are very well informed. So thank you so much for the Yeah. So, next question is, now many many patients with lazy eye, or many parents would say, my child can see well. There's Why does he or she need glasses when you have a lazy eye? Or
Okay. Okay. I think we are on to slides. Okay, glasses. If you go down to Warren, if I have can go back to slide number 14. Slide number 14, which is
oh, I mean, why do we need to?
7A. You need to go to
Why do
7A
we, why do we need to patch the
to wear
eye?
glasses.
Or
Mm,
why do we need to wear glasses? Yeah,
yes.
they might ask the question.
Okay. Okay. Yeah. All right. Now, okay. Wearing glasses again is a common question. Okay. Now, the reason for most people needing to wear glasses is actually to do with the shape of the eyeball. As you know, in newborn baby, normally when they are born, the eyeball is actually shorter in length. So if you look at the length of the eyeball, the axial length, the front to back of the eyeball length. Now, for newborn baby, the eyeball is actually short. Okay, and we sometimes say that you don't need to wear glasses because it's within the normal limits. But however, some children, they do require glasses because when they are born, they have abnormal length of the eyeball. The length can be too long, so that is short-sighted, or maybe too short, that is very very long-sighted. So if you don't allow them to wear glasses, as in the picture here, then the input from the outside world do not actually enter the retina sharply. You get a defocused image. So when the image is defocused, you continue to let the child have a defocused image for many years, especially during the visual development time, what happens is that the vision does not develop. They become a lazy eye. Therefore, it is essential for the child to wear the glasses. So glasses is essential. When there is a need for glasses, it must be given. That is for the needs of glasses. Now, and to answer your question about the treatment for the lazy eye, now after they wear the glasses, obviously the vision has not been developing well for some period of time. So perhaps for a year or two, to be able for us to pick up that the vision has not formed, is not seeing as well as compared to the other eye. So in this instance, what you require then is actually to let the vision in the lazy eye catch up. So in this case, put on the glasses, then patch the good eye, the one that has been receiving the input all this while, and let the other one that has not been receiving the input have the stimulus. So you cover up the good eye, and the other one is forced to receive the input until such time that the vision in the previously abnormal eye or reduced vision eye comes back to normal. And the glasses wearing is also very important. As you can see in the picture, in some cases, not all cases, in some cases, when you put on the glasses, it actually straightens the eye out. So it actually straightens the screen. Now, this is important again because if you straighten the eye, if they are able to use the two eye together as a pair, then you have less chance of having a lazy eye. I hope that's helped. Okay.
Um, Now, a very good explanation. Um, at what age does a child develop a lazy eye, or rather, how do you diagnose a lazy eye? Is it from the womb, or is it from
How do you diagnose a lazy eye?
and can it go away after?
Sorry, Raswin, I can't hear you because the line is bad. Can you repeat the question again,
How
please?
how How do you
Sorry,
diagnose
I
a lazy eye?
can't hear you.
How do you diagnose a lazy eye?
Uh,
With
yeah, I think we have lost her for a while.
yeah.
Yeah, so she will be connecting shortly. But if you can, Rajwin, share a little bit about how did she come about in your life?
While waiting for Miss Casey came about in my life when when I was 18 months. 18 months, I had the squint surgery. Now, after the squint surgery, she she actually she and an ophthalmologist, my dad's friend, um, Dr. Barry Cullen, they both worked hand in hand.
Mm-hmm.
So after uh, before the before the op- before the operation, she told us what to do, and after the operation, uh, I saw her for a couple of months. The treatment was patching and so on, and patching, wearing glasses and also doing the corrective surgery.
I
Now,
see.
corrective surgery is very important uh, for a patient for a patient with squint. Who develops is squint and lazy eye is most common among cerebral palsy patients or any neurodevelopmental uh, condition like cerebral palsy, mainly cerebral palsy. Uh, and I started wearing the glasses at the age of 2. Now I changed I changed the glasses every 1 year to follow up, uh, to check my power and to make sure everything is all right. Yeah.
I see. So
So
it's a correct glasses, yeah.
yeah, it must be checked by an optometrist.
I see. I see. Okay. Okay. And you have to do it every year. Is that what you're saying?
Yeah.
Okay.
Autopsy autopsies comes a lot hand in hand with a ophthalmologist. Opto-
Hmm.
Autopsies will then advise the ophthalmologist like this is the problem, this is what we have to do. Then the ophthalmologist will then follow up with the op- autopsies and optometrists hand in hand.
Hmm.
So
I
now
see.
it's been 36 years and I'm blessed with the gift of sight. So
Yeah.
um,
I think it's important that everyone should know these are the things that you can do. So if you have got a child or anyone whom you know that who have got squint eye, also lazy eye, it's a condition I think can be corrected, like what Rajvin also said, and as what Casey was mentioning. So I think we need to really take initial, very quick precaution and action to make sure that something is done very quickly so that the child can be safe. Am I correct to say that, Rajwin?
yes.
Very nice, very nice. So we still do not have Casey online, but I think we can pretty much go ahead with what else that you have for sharing, Rajwin.
So basically the I think adults do also have adults can also have squint or lazy eye. It's just that depending on how well they take care of it.
Mhm.
So my final words for for this evening is, you know, while we wait for Casey,
Yeah,
I
Casey
just
is here.
Sorry. The line
No
so
worries,
much line
Casey.
problem.
It's okay. It's
Hello.
okay.
yeah
Yeah,
yeah.
Yes. Mm.
So
go ahead, Rajwin.
my final words for this evening before I ask Casey to show a few exercises is uh, you find it's better to uh, treat it's better to treat squint and lazy eye before it's too late. So vision is one of the most important vision or sight is the one of the most important uh, sight most important organs in among the five senses. So take care of it and love your love love your sight. Thank you.
Yeah. So you want to go ahead with Casey?
Uh,
Yeah.
sorry. I can't hear properly because the line is so bad. Maybe you could just have a quick.
Yeah. So Rajwin has got some exercises that she wants you to do.
Yeah.
Go
Okay.
ahead,
So
Casey.
so Casey, before you do the exercises,
Okay.
I would like to ask you, uh, does adults have a lazy eye?
Okay. Of course. Yes. Naturally, I think we are looking at does adult have lazy eye? Okay. Sure. And we were looking at here are some pictures to show you, and we will look at maybe looking at slides number 18. Slides 18. So you'll be able to see. Can I show? Yeah. Of course, adult do have lazy eye. Uh, if because the reason is a vision lazy is just a visual development issue. So if you don't treat your lazy eye, then you have lazy eye throughout the rest of your life. Now, similarly, um, with squint, so squint is can present in adult as well because any time during your life, if you were to have an accident, for example, and affect your eye muscle, then your eye can go off in different direction as well. So this actually adult squint. Now, sometimes not only are they disfiguring, the issue is actually in adult when you have a squint, you have a lot of double vision, troublesome double vision because one eye looks in one direction and both eyes are able to receive at the same time the two input. Whereas in a child, often they may not complain of double vision because they've learned to, as I mentioned earlier, they learn to use only one eye. They actually shut down one side. So in adult, they can have double vision and it's very troublesome. Now, then coming to uh, adult and the issue with, of course, double vision and squint late in life, the most important thing is actually also they have to seek the advice of their doctor, the medical doctor. Maybe they might need to go for further medical checkup as well as to the cause of the squint in adulthood. Okay.
Thank you, Casey, for explanation. Any final words before we
Okay.
move to the
Perhaps,
exercises?
yeah. Okay. Perhaps I think in all topic relating to squint, we need to talk about a little bit about pseudo squint. I think that would be on slides number 19. Okay, if you can show the picture number on slide 19. Yeah. Now, commonly, a lot of people think that they have squint. Squint is actually not, well, it's common and yet not common. When you see one, you see one. If you don't see it, you don't see any at all, because it takes only about 3% of the population have a squint eye. Now, commonly, what you have is called false alarm. We call it pseudo squint. Pseudo squint is common, and you may not necessarily have a squint. How would you know if you are not sure? Then obviously, then you better have it checked out properly. Just avoid the presence of a lazy eye. A lazy eye treatment is only before you are aged 7 to 8 years old. So, but however, not to alarm most parents, do know that pseudosquint is quite common. So if you look at this picture, the two eyes look as if they are turning inward, but actually it's because of the broad bridge of nose. We call it epicantic folds. And because of the bridge of nose, it gives them the appearance of the squint. So if you lift it up, you actually see that the eyes are actually aligned correctly. And the last slide maybe to share with you, the last one, the last slide is to says to you that most people, if they have lazy eye, we know that it's only treatable before the age of 7 and 8. But there is no age limit if you have a squint. Most squint can be realigned and can be repositioned. So age is not a barrier to repositioning of the eyes. But of course, it cannot be the same for binocular vision, because for lazy eye and binocular vision, both of these are actually developed in the first 7 to 8 years of life. But to look nicer, to position the eye better, there is no age limit. Okay.
Thank you, Casey. So, uh, yeah. Can you show us some eye exercises if you may?
I didn't have the video. I would have liked to make the video. Put it that way, if the eyes are actually sideways movement, you want to tighten the inner muscle, okay?
Yeah.
Which is a lot. So you see them doing things like holding a pen and focusing on that, okay?
Focus.
Now for focusing on the pen to try to get it into one. These are especially for people who has problem reading. So when they read something, they complain that the words runs. So there is usually a weakness in the two medial muscle here. So you look at the pen and try to focus on it, you get it back into one. And you should be able to bring the pen close to you and still seeing one. Most people will look at it as creating a cross eye effect, okay? So this is one very common exercise most people do. Now, the second actually exercise will say that whether you have binocular vision or you are lacking of it, you just hold the two pen up, one aligned to the other in front, one back and one front. Now, here, for example, there are two pens. I'm holding a purple pen and a blue one in front. If you look at the purple one in front, don't look at the one at the back. Just concentrate looking at the one in front. You notice there are actually two pens at the back. So this is actually a normal phenomenon. So it is a way to tell you that you are actually using your two eyes together. So look only at the front pen, you realize the back become two. Or if you were to look at the back one, the front appears two to you. So these are just very rough idea and rough exercise that we utilize and improvise on to actually help them to build up better binocular vision. Okay?
Thank you so much. Any takeaway for the audience you want to say?
Sorry, I can't hear you. Sorry, Rajvin.
Any takeaway for the audience that you would like to say? Any? What is your
Any
key?
questions?
Yeah, any advice, Casey, for those parents who have got this type of children or a child whom they know who have got squint eye or lazy eye?
I think the first thing is that if they suspect they have problem with their vision, the child has problem with the vision, they do need a complete proper assessment. bring them to their neighborhood eye specialist or the eye personnel, have their eyesight checked properly, and if the doctors tells you that you do need glasses, then they should actually follow advice and wear the glasses. And from there, you'll be able to rule out whether they have lazy eye or squint. And that would be the next then assessment that we need to go into detail. And you have to they must bear in mind that children visual development is in the early 7 years of life. So it's very, very important and crucial that if there is something wrong, do try to have it looked at early. Okay?
Yeah. Very, very informative session we had. I have had the honor to be to have met you since the early age of life, and I was sharing earlier about my my experience. My experience was
Yes.
very good uh, with the gift of sight. So my final words is cherish the gift of sight as you are blessed. Some of us may not be blessed with the gift of sight, but for most of us, the gift of sight is the gift of life. So cherish it while you still can, and go for your regular checkup and visit the doctor if you have problem, or visit someone like Casey if you need screen or lazy eye advice. Thank you very much. This is Rajvin Kaur signing off. Till next week with another interesting guest in Rajvin and Warren. Thank you.
There you go,
Thank you.
everyone. Rajwin did it again. Thank you so much. And thank you
Thank
so much,
you.
Casey. It was very nice. That was
Thank you.
an awesome sharing. So thank you, everyone. Meet again next week. Bye bye. Take care.
Bye. Thank you. Okay, bye.
Bye.